Hey everyone, welcome to another epilepsy education video. Today I wanted to touch on a subject that's a little bit heavy, just to let you know, but also very necessary to take into consideration when you are talking about someone with epilepsy. So that topic is health insurance and costs. So I'm not planning on getting political with this at all, as much as I can, staying away from that. That's not the point of this video. The point is more to just give everyone an idea of costs and experiences, just awareness once again. So let's get into it. The first thing that was coming to my mind the other day was about ambulance costs. So I've been on several different types of insurance, everywhere from Blue Cross Blue Shield, which is one of the best health insurances, I believe, in the country, in the United States, and I've also been on like state insurance. I think that's part of the, like, Obamacare or whatever. But anyway, so I've been on a wide range of different health insurances through my jobs, through various different reasons. But anyway, point being, I know that at least one time when I did have to take an ambulance to the ER due to whatever seizures I was having, someone had to call an ambulance for me. I remember getting a bill for the ambulance and the ER visit, and it was around $2,000. And I've even heard some people tell me they've had $5,000 visits, ambulance rides and ER visits. And I'm just gonna say that, like, I respect all the medical workers and essential workers and ambulance workers, but it's a little tough to swallow that big of a bill, especially for me. At least most of the time when I've been in an ambulance and gone to the ER for seizures, it's, basically what they'll do is they'll give me some medication to make it stop, have me rest, and then tell me to go home and rest some more, get some sleep. Occasionally they'll take some blood tests to make sure that my medication levels are at the right levels, that they're not too low or anything. But yeah, for me, I feel like that's something I could usually do at home if I'm having a lot of seizures and they're not really stopping. I'll just take like an extra certain amount of medication, because in the past, that's what my neurologists have advised me to do. Even when I was a kid with my family, that's what we were advised to do, rather than go to the hospital every single time. Now, I am not a doctor. Please don't take anything I say as like medical advice. Always check with your own neurologist and doctors if you do have this condition. But just sharing my own experience, I can take some extra medicine. I can make myself take a nap at home, or leave work early if I need to, depending on where I was working. But point is, it's something I can do myself rather than pay $2,000 to basically do the same thing, maybe with a little blood test, depending on the situation. And I know a lot of people who with epilepsy kind of share this experience. And same thing with health insurance and health care. So medications for epileptics can also be very expensive. For instance, the ones I'm on, the brand name ones are the only ones that have worked for me. Some people are able to take generic medications and have them work, which is great because they're way less expensive. But the two medications that I'm on, if I didn't have any insurance, would be around $3,000 every month. And that's, I think, more than many people anyway, make in a month. So I guess good thing to have insurance in that frame of reference, in that frame. But also, I've been on, like I said, a couple different insurances, and for example, on Blue Cross Blue Shield, even though it's a great insurance, I still had a copay for those medications, and it was close to $400 every month. And this past year with COVID-19, I was furloughed from my job, but somehow, they were able to keep me on their insurance, right? So that was the Blue Cross Blue Shield. But I didn't have any actual income coming in my particular situation. So here I was on unemployment and paying almost $400 as my copay just to take my medication, so that I don't have a ton of seizures and end up in a really bad situation. And I can tell you right now that copay is more than or maybe not more than I got in unemployment in a month. It's not that much, but it was an enormous chunk of it, like an enormous chunk of it. Thankfully, I have people around me who have been willing to help me out and support me. But eventually I had to just tell my employer, please take me off of your health insurance. It's, I explained to them what I just explained to you. It's not sustainable for me. So I went back on the state health insurance, and the two ones I've been on with that, in one instance there's been no copay. That's more recently what I've been on, maybe because of COVID-19 and current situations, but I've been on it in the past before when I was in between jobs, and that was only like a $3.50 copay for the same medications. So an enormous difference, right? A huge difference. And one of the other insurances I've been on, I think when I was in college and when I taught yoga and meditation a couple of years back, was Aetna. And my copay for that was, I think, $20 per medication, so $40 in total every month. That was way more realistic and doable for me in proportion to my income and other expenses and just everything. So I just wanted to give you guys a little insight into that, a little perspective, because that really adds up, all these things. That doesn't even include copays for like doctor's visits or blood tests or special tests. Sometimes people with epilepsy take EEGs or MRIs, different tests to see where in the brain the seizures are coming from. All of these things are additional costs, and sometimes some health insurances cover it or part of it, sometimes they don't. So it can be very difficult for people with epilepsy to pay all these bills, and it's really quite sad. At least in the United States, that's where I am. I'm not sure about other countries. If you're from another country and you want to chime in the comments, feel free. I would love that. I always like to learn. But yeah, and then there's, of course, something we'll touch on in a different video, because I feel that deserves its own time and space, is the fact that some people who have seizure disorders can work, and for the most part are fine just working whatever job full-time, and others can only work part-time because of the severity of their epilepsy or trying to manage the triggers, which a lot of times are stress and getting enough sleep. Again, more on that later. And other people with epilepsy can't work at all because the seizures aren't under control, or it's affected their brain so much, for a variety of reasons. So again, just a little insight into the financial cost of this, because it's quite interesting. And as I'm sure with other disabilities and conditions and illnesses, but something that just I felt needed to be addressed. So if you guys have anything you want to chime in, feel free. I would love to start a discussion around that. Maybe we can start thinking of ways how to make it better. But for now, that is the sharing. Thanks guys so much for tuning in. I really appreciate it, and I'll catch you next time.